Well, for those of you who take any kind of medication, imagine the little pill you trust having no active pharmaceutical ingredient or no therapeutic value whatsoever to them. A WIS investigation finds numerous online pharmacies sell pills that have rat poison, wallboard material, road paint, heavy metals, and the list just goes on and on of dangerous materials that are inside.
When you buy online, there's a 50% chance that you are going to buy a counterfeit. And just recently, the National Association of Boards of Pharmacy just came out with a statistic where they looked at 10,000 websites offering pharmaceuticals. And of the 10,000, they found 97% did not meet the patient safety specifications that they would require.
Be sure to catch my full report on phony pharmacies this evening on the news at 5 p.m. And in today's news for you, from Prosperity Drug Company, the president of the South Carolina Pharmacy Association, John Pugh. It is kind of scary. Now, obviously, you're a pharmacist, you have a business, you want people to go in there. But speaking objectively and speaking as the chairman of all the pharmacists, why is online pharmacy shopping so dangerous?
Well, as your report indicated, so many times what you're getting is not actually the medication that you think you're getting. These things are fraudulently produced products. But not only that, we've seen and heard reports where people who are giving up a lot of personal information, credit card information, are giving thieves really enough information whereby their identity could be stolen, their credit card information can be stolen, and all sorts of things on that front as well.
There's a lot of talk from medical experts, especially doctors, saying they want a person to have one pharmacy, one pharmacist. Why is that so key?
A pharmacist can take better care of our patients when we know all the medications that you're on. And I think it's very important to have a pharmacy home, if you will, and that's the stance of the South Carolina Pharmacy Association. We want patients in South Carolina to have a pharmacy home and to have a pharmacist that they go to that they can count on when they need to get their prescriptions filled.
Because I've heard a lot of stories where a patient may be on 10 different medications from 4 different doctors, but you as the pharmacist could look at that and say, you know what, you could take these 3 and get it down to 1 pill. But if you're shopping all around,
absolutely,
you're not going to know.
Nobody knows what's going on, and nobody can take care of you the way that we could. You may be getting 2 different drugs out of the same class from 2 different pharmacies and end up taking them together, and it cause you harm. So it is important to have one pharmacy where your complete medical record is maintained.
Now, while there are online pharmacies that are legit, and we do want to emphasize there are some on there, there are just so many that are not. But one thing that's very key is that, let's say the example you and I talked about earlier in the break, if someone goes in with high cholesterol and they say, hey doc, the Lipitor isn't working, perhaps the doctor should be asking more, well, where are you getting the pill? Not so much, well, it's not working, so let's give you more medication, because it could be that their pill's not legit.
Absolutely. And also another thing, it's important to look at the adherence. Is the patient taking the medicine as it's prescribed? And there again, having that pharmacy home and that pharmacist to go to can really help you to make sure that there's not other issues going on besides you need a higher dose. And that's something that we see every day.
You know, John, what's hard though is a lot of people are going online because they want to try to save money.
Absolutely. But there's opportunities to work with your pharmacist. There's never been more generics available in the marketplace as there are today. If there's something that you can't afford, again, that's a benefit that you can reap from knowing your pharmacist and them knowing you. Come in and talk to us and explain to us your situation, and we can work with you to try to find alternatives, maybe things that are covered better on your insurance, and work with your doctor or provider so that you can get those drugs and get the outcomes that you're looking for. Because at the end of the day, health is what this is about, and that's what we want to get to.
Excellent information. John Pugh, the president of the South Carolina Pharmacy Association, thank you so much for that. And if you do choose to buy your prescriptions off the internet, we first want you to encourage you to go to the National Association of Boards of Pharmacy, the name there, it's on the big red 10. And to watch the full interview with John, go to Twitter at Dawndy WIS TV or my Facebook fan page, Dawndy Mercer Plank WIS TV. This will be on there coming up shortly. John, thank you.
Thank you.